today we've got Dylan Kelly and Leah Holderbaum, both part of our Numotion team. And we are going to be talking about catheter questions that they're too afraid to ask. So I've got some funny statistics, just frequently asked questions, and then questions for either both Dylan and Leah or just Dylan and just Leah. So basically, if you've ever wondered what to do if your catheter falls in the toilet at Chili's, or who to call and reach out to if you're ever in a jam, you're not alone. Today on the Ally Program podcast, we are diving into everyone's questions that they're too afraid to ask. So first up, I'm going to call on Dylan. Dylan Kelly, take a couple minutes and introduce yourself and what you're excited about the Ally Program, and how do you want your podcast segment to be like?
Yeah, so as mentioned, my name is Dylan. I'm from Tampa, Florida. And I'm just really excited about the Ally podcast and what it brings, because I think I'm mainly excited about the community aspect of it, being that everyone with spinal cord injuries, no matter where they are around the country, will be able to access this. I know it depends on where you live, but sometimes you can feel a little isolated and definitely different from the community around you, possibly. So to have a program like this, to be able to go ask questions and speak with peers and stuff like that, I think is really important, especially those with newer spinal cord injuries. And then it's going to be awesome with those who have been doing it for years to be able to help everyone out. So I'm excited to see what it brings.
For sure. Tell us a little bit about what we're going to see with you this season on the podcast.
Yeah, so my segment, Wheeling with Dylan, is really, at the end of the day, I just want it to be a laid back conversation between, hopefully just friends, or for some guests I'm just meeting for one of the first times. But I just want it to be super laid back, conversational, not some formal interview, and just really talking about day-to-day life, what it's like to be independent, how people have found different ways to improve their quality of life. And what I want to bring out is that everyone does things differently. So One thing that I do to maybe be independent, how I take out the trash, for example, how I go grocery shopping, how I, go out, and my ideas for date night, maybe, though I might think this works really good for me, and it does, but someone else might do things completely differently. And we can learn from each other and find new ways. So I'm really excited to kind of navigate that and learn from other people's experiences. And I hope that everybody who listens will also benefit from that.
No, that's amazing. Super. I'm excited for it. Well, I've got this segment for you titled Let's Get Awkward. And so I'm going to just ask you a couple questions, and first thing that comes to mind, or whatever you care to share or not share, totally up to you. But what's one catheter moment you'll never forget? The good, the bad, or the really drippy?
The first thing that comes to my mind is one that stunk. It was a bad one. And it was like, hadn't even had a spinal cord injury for a year yet. So still, obviously, you're adjusting to everything. But what this one shocked me, because I had bladder stones, and I do have sensation, and it hurt really bad. So it was genuinely the most painful experience of my life. Like, I have literally,
Oh yeah.
Not even a year before that, I was in a car accident that did hurt a lot, but those bladder stones were something else. And it stunk because it was like right on the weekend, so I couldn't just go to the urologist right away. It was one of those things I did go to the ER, but they couldn't even do too much. I had to wait it out a little bit. So it just felt like a really long 24 to 48 hours, but that's the one that sticks out to my mind.
Oh yeah, for sure. No, that's so crazy. Have you ever seen bladder stones under a microscope, and how their spine? It's crazy. Google it, look it up. You will get it. You'll be like, that's exactly what that felt like. Yeah.
So I think they might be there. I think they're bigger than kidney stones, right? Or no?
I don't know about the
I,
size. It's more or less the texture. Like they're very
yeah,
jagged,
they were
rigid.
bigger than I thought. That's all I'm gonna say. I was like, whoa.
Someone's like, I've kind of had a baby. No, I'm just kidding.
Yeah, like 10 of them.
Puppies, dogs have nothing on me. So describe the first time trying to cath in a public bathroom. What went wrong or what went surprisingly right?
Um, to me, it doesn't make much of a difference whether you're home or out if it's accessible, obviously. But the first time that like I had to do it in public was when I was at Shepherd Center. So it was one of the outings that we had done. So it was good because I had Shepherd Center, for those who don't know as well, is like a rehab for spinal cord injuries in Atlanta, Georgia, which is where I was initially. But anyway, so we had gone there, and of course, it wasn't accessible. And so the good thing though is I had like it might have been an OT. Like I don't really remember who was with me.
It probably was an OT.
It probably was an OT. It probably was. Leah's favorites, my favorites. And I think they had kind of blocked out like the doorway or something so people couldn't get in because it wasn't accessible. And I did it like near like a urinal kind of thing. So I remember that was like pretty stressful. I remember being like, is this what it's always going to be like?
Yeah.
Those kind of scenarios where a bathroom isn't accessible, it does happen. And there's ways to navigate that for sure. But that was one of my first experiences, which was a little shocking.
But then like each time it started to get more easier, right?
Yeah, it's easier, and you normally try your best to just find one that you can fit in and it works.
Yeah.
In this case, I had someone with me who just blocked the doorway, but you don't always have that. So
correct. Very true. Very true. And relatable. Okay. Have you ever forgotten your cath supplies and had to MacGyver a solution?
Not yet. Let's knock on wood. Not yet. I am very, I don't know if I'm an over worrier, but I make sure that I'm always have supplies on me.
Okay. Do you know who MacGyver is?
No.
Do you know who MacGruber is?
No.
Okay. So MacGyver was, and Leah helped me out with this one, guy in the 80s that he could take just like raw materials and put something together and be able to blow the door off of this secret locked room and save all of these people with just like wood and
battery, toothpick, and a macaroni noodle.
Yeah. The most obscure items. So it's kind of like if you've ever been in a situation where you're ill prepared and had to use something. Now, knowing you, Dylan, I know a little bit, and it may not be catheters that you MacGyver, but there are things that you definitely know how to MacGyver out of raw materials.
Mm-hmm.
Yep, and make it work, right?
Yeah.
Yeah. Yep. You're like, don't sell me out, Jenny. Okay. So be honest. Have you ever peed on your shoes?
Not yet. But we'll see.
I don't know if our clinical counterpart, our educator, could medical supply educator could say the same. What's something new every user should keep in their emergency cath pouch that no one tells you?
So I am probably not always the best example. I don't carry like anything else on me really, but I'm sure having some like gloves that are wipes or something like that would be smart. Okay. So maybe I'll take note and try to do something like that.
Gotcha. All right. So just straight cath.
Yeah.
Got your kit. You got, okay. All right. Last one for you. And then you're out of the hot seat. What's the worst advice someone ever gave you about cathing?
I mean, I've heard a lot of people just be like, you don't really got to wash your hands and do this and that. Because, I think you do it so many times. I think people just take it for granted and don't think about it. But that's like the worst advice. You have to wash your hands.
Yeah.
Like, no matter what. It doesn't matter how good of a catheter you have. Even like the closed systems that reduce UTIs and like really shouldn't really have to touch the cath at all. It doesn't matter. Wash your hands. It's like the most important thing, I think.
Absolutely. Yep. Agreed. Agreed. Okay. Thank you, Dylan. You're amazing. Looking forward to your segments.
Thank you.
Right. Clinical questions. You're thinking it. We're asking it. Leah, what?
Yes,
okay.
ma'am.
So let me back up just a little bit.
Okay.
Take a couple minutes, introduce yourself, your segment,
Sure.
what you want out of your podcast, and why you're
Yes.
excited about the Ally program.
Absolutely. I am pumped about the Ally program. I have been thinking about this program for well over a year now, and it has been a lot of blood, sweat, and tears and brain power. And I am just so excited that it's finally happening. And my background is occupational therapy, specifically spinal cord injury and bladder management. And it was during my time at a model system rehab when I realized that occupational therapist played a significant role in bladder management. And I was doing the majority of my patients a significant disservice. So I didn't understand everything about, bladder health, bladder management, catheters. And I started doing research, and that was just the start of this passion that was, lit within me. So I have made it a goal of mine, shall we say, to spread love and education and advocacy for all things bladder management across the country. So now that this is actually happening, it is a beautiful place for individuals to come and connect, share resources, share stories, gather experiences. And it's a program unlike anything else. So I am beyond pumped about the Ally program, which ties nicely into my podcast segment, which is going to be called the Cathcast. And again, as an occupational therapist, I really want to educate not only catheter users, but clinicians as well on resources, adaptive equipment, up and coming research, infection prevention, strategies, all of these things. And I really want to normalize discussions around bladder management. So I've got a lot of special guests that are coming on, from clinicians to users and everything in between. So I'm really, really excited about everything that's to come with the Ally program and the Cathcast.
Yay! We are too, for sure. All right, are you ready to dig in?
I hope so. Let's go.
Okay, what's the wildest myth you've heard about catheters that just isn't true?
That they're one size fits all.
Ooh.
That this product is the best for whatever patient. Mm-hmm. And that's one thing that I've found is I always say catheters are like Starbucks. You have as many options on catheters as you do menu options at Starbucks. And it's not one size fits all, based on situation, based on body, based on diagnosis, based on features and benefits. And so I think it really comes down to, what can that person use functionally and, be ultimately healthy and independent.
Yeah, so, absolutely.
Yeah, one size fits all.
So true. That is... When I get to the frequently asked questions of what has been searched on the internet, which is coming up, you'll see the number one question. So,
okay.
Ties. Cool. All right. I mean, no spoiler alerts for later in the show, but that's where we're at. Are there best practices people forget, like drying their hands before touching a sterile kit?
Okay, so this is an interesting question that I'm torn about, because I heard Dylan's input about, washing your hands. And as a clinician, I 110% agree. I do think that people, just becomes habit, and they just, forget to do simple things, or you get in your routine. We all do it, right? That being said, I will never forget, I had a young man who would pull his catheter from the brim of his hat and spit on it, cath, rinse it, and then put it right back in the brim of his hat for his next use. I don't support this. I do not think this is optimal for him. However, this young man had not had a UTI in I don't know how many years, because his body had built up antibodies. So again, I think it goes back to, it's not a one size, fits all situation, and everyone is going to be a little bit different. I do think it is very easy to kind of just get into the mundane and just leave out, some simple details when it comes to, hand hygiene, proper cleansing. One thing that I really speak a lot about, specifically with my friends that are, chair users, is the cross-contamination. If you go into a public restroom and, you wash your hands initially, that's fantastic. But then if you go into the stall and you touch the lock, what else are you touching? You've touched your wheels. Yeah. So I think that's something that kind of just goes by the wayside, as well as just the possibility of cross-contamination across all surfaces.
Oh, okay. So how do you handle questions like, can I still wear leggings, or will my date notice my leg bag?
Let's figure it out to make it how you want it to work for you,
Yeah.
Do you want to wear leggings? Okay, let's make it happen. How do we, if this is what you want to do, let's figure out how to make it happen for you. Will your date notice your leg bag? Maybe. But can you talk about it? Can you normalize that conversation? Like, everyone needs to use the restroom. Yeah. So at the end of the day, if someone is going to not date you because of your leg bag, then they're not worth your time. So move along.
Thank you. Next.
Right? Yes. Mm-hmm.
Okay. I love this one. Be honest. How many patients pretend to know what clean technique is and then wave their cath around like a glow stick?
Yeah, it goes back to my friend, right? Again, best practices are one thing, and you really want to make sure that you are maintaining the proper technique for you, which is, washing your hands, washing around that urethral opening, making sure that you're not touching the catheter. As a clinician, I am telling you to do all of these things. However, the clinician in me got a little slap on the wrist when that young man with the catheter in the brim of his hat told me that he hadn't had a UTI in 20 plus years. And, he'd be darned if he was going to change his ways now. So, again, it just goes to show everyone is individualized, and you do have to take it on a case by case basis. And absolutely. People are going to figure out their own strategy. And at the end of the day, is it keeping you healthy? Are you, free of UTIs? Is your bladder empty, as it needs to be? And how is your quality of life? So for sure. That is the ultimate goal at the end of the day, is can we keep this in place? But again, as a clinician, the OT and me is always trying to promote the optimal strategy for hygiene with that individual.
We wouldn't expect anything less, right? This one's a multiple choice.
Okay.
If someone tells you they reused their catheter just once, do you A, cry a little, B, slap their hand, C, hand them a UTI fact sheet?
All of the above.
Yeah.
Number one, my first concern or my first question would be, what type of catheter was it? And the reason for that is because catheter technology these days, they are designed for single use. And depending on the material of the catheter, the coating, the lubricant, I would be concerned for the potential of, urethral trauma, or, is the catheter too tacky? Like, that would be my initial concern. Again, I do think it's important to always educate the individual. So I would definitely, like I said, I would do all of the above, definitely discuss infection risk, talk about UTIs, talk about how to limit the possibility of running out of catheters in the future, trying to help them become more of an advocate, for themselves, for their care, making sure they have appropriate supplies. And a hard lesson that I've learned is I can provide all the education and all the training, and at the end of the day, it's the responsibility of that person. Absolutely. So I, again, I just encourage individuals, be educated, be advocated, especially, OTs, make sure your patients are well versed in, what they need to do. But at the end of the day, it's up to them.
Yeah,
so.
For sure. All right. Last one.
Yes.
What's the most awkward way someone's ever asked you if they can have sex with a catheter?
I think not asking, honestly.
Oh.
Because there is a direct correlation, and bowel and bladder function directly tie into sexual intimacy. And with the majority of my patients, I never want to say all because I'm not a fan of definitives, but with the majority of my patients, I would always try to, bring up sexual intimacy in some capacity, because I wanted them to know possibilities. I wanted them to know that I was open to have the discussion. And I think by not asking questions or, not seeking resources on your own, I think that's the most unfortunate thing, that you could do. And all that to say, you can still be sexually intimate if you do have an indwelling catheter or if you do intermittent catheterization. So you do have options. And I think it's important that people educate themselves and are empowered to ask those questions and realize that it's okay. And if you have that question, there is probably someone else that has that question. And I guarantee there is someone out there who is eager to answer that question for you. So you just have to find who that person is.
Absolutely. No, that's great. Thank you.
Of course.
All right.
Hey, I'm Dylan from Wheelin' with Dylan.
And I'm Leah with the Cathcast. If you're listening to this, you are already part of the conversation, but there's a lot more to explore inside Numotion Medical Supply's Ally program.
And all our podcasts live there too. So if you want to catch past episodes or get the earliest access to new ones, that's where to go.
And the podcast is really just one piece. Inside Ally, there's a full library of articles, webinars, and short videos focused on bladder health, catheter use, and building routines that work for you.
It's also a great place to see how others are navigating things day to day. Real setups, real experiences, and things you might not always hear in a clinical setting.
And a big part of that is the community forum. There are sub-forums for different experiences and stages of life. So whether you're just getting started or have been doing this for years, there's a space for you.
You can ask questions, share what's worked for you, or just read and see how others are handling similar situations. It's a really easy way to connect and not feel like you're figuring everything out all on your own.
And it's simple to access. If you're a Numotion Medical Supplies customer, you can log in with your My Numotion account information and start exploring right away.
It's completely free, and everything's in one place at catheters.numotion.com/ally.
Head to the Ally program today and join the conversation.
We'll see you there.
So now we have the OOPS file, mishaps and solutions. So these are, open to both of you, right? So
Okay.
Answer which, if you've got something, say it. What's one catheter fail that became a laughable memory?
I got mine right off the bat.
Go ahead. You can take this one.
Okay. So one of my most rewarding and life-changing experiences was I was working with a young lady, and we were progressing her through her intermittent catheterization plan. She had done fantastic in the bed, and next we're working on wheelchair cathing. Long story short, she, rightfully so, is becoming a little bit frustrated because just with positioning, clothing management, female anatomy, she was having some challenges with cathing in the wheelchair. And mostly it was attributed to anatomy. She continued to, insert the catheter accidentally into her vagina. And following that, I will never, ever forget, we were in her bathroom. We were working so hard on her becoming independent, and she used the most innocent yet descriptive words to describe her anatomy. And I agreed with her descriptions and I guided her. And from then on, she was 110% accurate with her cathing. And it came down to, again, as the OT, I was trying to provide, I'm like, that's your urethra. Like, I'm using the appropriate terms, and she knew where it was, but it wasn't resonating based on anatomical landmarks. So it was a huge flop that turned to a complete success, all based on just changing, the terminology surrounding the anatomy. So I will never forget that experience for as long as I live, ever.
That's great.
Sting.
Yeah. Dylan.
#bless. Yeah, right.
Has TSA ever pulled you aside for your cath supplies, and what happened if they did?
Yeah, they have for me a couple times, just taking a look at you have your medicine bag. I think that's what it's called. But for me, actually, this is kind of along with your question. It's always like the bag under my chair with security, TSA, because sometimes sometimes, I've done it a couple times, I forget to take that off to get it scanned as well. So I'm thinking about my luggage that I have, and sometimes I forget about like the bag on my actual chair. So sometimes we're like, hey, what you trying to bring in? I'm like, I'm just trying to go to the bathroom, dude. Like, but my bad. And then we'll run it through. So that's normally what happens to me. That's happened to me probably like 3 times at least.
Jeez.
Okay.
Leah?
So I have been stopped by TSA. I don't even know how many times. So as an educator, when I would travel and provide, in-services, education, CEUs, I have silicone models. And I eventually had to figure out the most detailed strategy so that I could get these models through TSA and not traumatize the TSA agent and anyone else around when my suitcase was open. So it consisted of me, I had to put them in like a Numotion, drawstring bag. And at one point I had to explain, I was like, I'm an educator. This is what I do. And as soon as TSA opened my bag, he grabbed like a dowel, like a, long stick. And he was like poking around in there. I'm like, they're anatomical models. So it's always interesting to try to explain what I do with these silicone anatomical models that pop up in my luggage. So
I would have loved to see if he would have pulled the male anatomical one out by the part.
That happened one of the first few times, and like the people around, because they just open my suitcase and start digging through.
Right.
And then I learned I have to like keep it enclosed, and then I open my suitcase, get that out. It's a whole process. So.
Oh my gosh. People seeing you walking through. There's the lady with the stuff.
It's wild.
That's great. That's great. All right. So let's see. So questions they're afraid to ask. Can a catheter fall out? What should you do if it does?
Don't use it.
Yeah.
If it falls out and it's exposed and it's on the ground, you throw that away.
Okay.
Yeah.
Trash.
Once it's been put in your body, get another one.
Okay.
So keep in mind, if you do have any spasms, specifically around, that urethra, sometimes if you have a spasm, that sphincter muscle can kind of push the catheter back out a little bit. So, those with female anatomy, those that might have, spasms, anyone that might potentially, dexterity issues, drop a catheter. You want to make sure that if there's any risk of that you do have a significant, backstash. You want to make sure that you have the appropriate quantity that, is going to get you through the supply that you need.
For sure. You can talk about that with your doctor too. So if you typically go 4 times a day, it's nice if they prescribe 5 or 6 so that you have a cushion to fall back on, a buffer.
Correct.
Yeah. No. Well, so Leah, on that, like I've had a customer that did have a spasm in the middle of cathing. What is the correct technique and to do with that? Is there breathing? Like, what would your recommendation be?
Yeah, usually, what I tell individuals is, when they're inserting the catheter, there might be a little resistance, there might be a spasm. Just try to, hold it in place, take some deep breaths, or, talk. Like I'll try to get the person to talk to me because you're breathing when you're talking.
Sure.
And then, try to, make it go in. Never, ever, ever force the catheter. And if you're meeting resistance and nothing is flowing, pull the catheter out, wait, and let's try again in a bit. But yeah, it's, it's not uncommon to, have that spasm or it's for the catheter to kind of almost like push itself back out a little bit.
Right.
It's when it comes all the way out that we're like, okay, we gotta do something. So that's why I usually say, keep a hand on, on that funnel or on that distal portion where, you have that extra little room for the grip to keep it clean.
No, great sound advice. This is amazing. Let's see. What should you pack in your bladder go bag for vacations or long car rides? Mad Libs? Anyone?
Absolutely. I mean, I'll chime in while Dylan's thinking, like just my OT brain, I'm thinking additional supplies, definitely. Catheters, depending on the type of product, whether it's gel or hydrophilic, maybe, potential lube, wipes. Again, there's a direct correlation between, bladder and bowel. So I also specifically for folks that have spinal cord injury, looking at, bowel supplies as well, whether it's, suppository, wipes, incontinence products, whatever you might potentially need for your specific bowel program. Also, I think, those with, female anatomy, looking at, menstruation products as well, because you never know. So
Yeah.
I think, those items, potentially change of undergarments, change of bottoms, or, whatever you prefer.
Yeah. Great
So,
call up.
yeah.
I
Just
just
a few
agree a
ideas.
lot. I agree a lot just with the extra.
Extra.
So I've had a couple cases of friends, people that I know who like didn't bring enough, and then they find themselves in trouble, and that's like my biggest nightmare. Which is funny because I'm literally like a catheter rep now. So like, if anyone shouldn't be too worried, you'd think it'd be me, but I always will bring extra. That's super important. And then if you are going somewhere where like very hot, and if you're going to Florida and you're gonna come visit me, not a bad idea to maybe bring like even like a little cooler kind of deal, not like a big igloo, but like one of those almost like lunchbox ones kind of thing. But that will help insulate some of those, especially if you're using a hydrophilic catheter, which is a water based solution in there that can dry up. It's not the worst idea. It just depends on where you're going to be. So for me, I guess specifically, if you're going to go out on a boat, you're going on vacation, you're going out on a boat, it's going to be hot all day. Not a bad idea to bring something like that. But
yeah, that's a great point, right? Like you're going somewhere, you're packing your travel bag, you're looking at what outfits to wear. Got to think of the climate and what's going on, and make sure your catheters are protected too. Like that's amazing.
Absolutely.
Like that's something cool. All right. Let's see. So real talk, real tips for Dylan. What do you wish someone had told you about cathing early on?
I wish they told me it's not that big of a deal. Like as far as just like, day to day, like you get used to it really quickly.
Yeah.
I wish someone kind of just told me just to chill out a little bit, because it's second nature to me now. It's as if it's like I'm going like normally, honestly. It just takes a little longer maybe, but it's not even that bad. And once you get used to it, it's like you don't even think about it. So
that's cool.
If someone told me that would have been comforting.
Rewind.
Yeah, right.
Leah, what do you tell parents who feel embarrassed? Or, not parents. What time is that? What do you... Okay. Leah, what do you tell patients who feel embarrassed about starting to cath?
I mean, I'm kind of with Dylan. Like, let's normalize it. It's not that big of a deal. Everyone has to use the bathroom in some way. This is a little bit different than what you did before, but let's figure it out. And I usually kind of give a preface of, hey, the first time we try, it's probably not going to be perfect, but we're going to try again with adaptive equipment or different positions or different strategies, adaptive clothing. Like it's trial and error the entire time.
Yeah.
So 9 times out of 10, I'm just hoping that I can help patients figure out how to problem solve through the situations. So, because again, it's normal, it's real life, we all do it, but how can I prepare you to be successful in all of those unknown circumstances?
Absolutely. Absolutely. Any tips for caregivers or parents of teens who are new to cathing?
Normalize it. And depending on the individual's level of function, if there is at some point the capacity for them to be able to do it on their own, let them, and facilitate that and advocate for them to be able to do it on their own.
Love it. It's great.
Period.
All right. So this last little part is the most searched frequently asked questions online. So I had kind of given a little teaser about it earlier, right? And so this is more of just an agree, disagree. This is not only the number one or the questions, top 6 questions, but the answers that came along with it. And this is just, an overall internet search. Okay. So the first one is, what size catheter is right for me? And the internet came back with, women often use 12 French, men typically 14 to 16 French, like finding the sneaker that fits just right.
I somewhat agree.
Okay.
I think women are typically around 14 French. 12 is a little bit small. In my experience, 12 is going to be maybe your preteen or maybe kind of like a young lady. Whereas, women, it's typically around a 14 French is kind of the magic number. And you said 14 to 16 for men, correct?
Mm-hmm. Yeah.
Yeah. I would say that's pretty common.
Okay.
14 is kind of the magic number for adults. Usually 16 will come in if there are prostate issues or if they're a little bit older.
Gotcha.
Dylan, what are your thoughts?
Yeah, I agree. Those are typically the ranges that I see. So in my territory, I do see some 12 French with women, but 14 is still, I think,
More common.
normal.
Yeah.
And guys range a little bit more. I've even seen them go up to like 18 or something sometimes. And it's not as common, but
yeah,
it's true.
Yeah.
Okay. So that one is a ish question.
Yeah.
Okay. How often should I cath? Is the question. The response is usually 4 to 6 times a day based on fluid intake and urinary volume. Spacing evenly throughout the 24-hour day helps avoid bladder overfilling. We agree? Disagree?
Leah's going to have more of an opinion than this on me. So I'm just going to say I agree that that's like the most normal amount, probably 4 to 6 times a day or something like that. But what I say too is you have to keep in count the fact that your liquid intake really affects that. So that's where I will, just a normal person who doesn't catheterize, if you drink some water all day, you might go a couple times. But if you wake up and you drink coffee, you're going to go more. If you drink a soda, you might go some more. If you drink alcohol, you're going to go a lot. So to say 4 to 6, that's very, kind of generic. It just really depends on your intake.
Right. For sure. Dylan, wasn't it you that had the really good advice that if you're out drinking and you're doing something and your buddy is getting up to go to the bathroom, like you just go with them because you're probably not feeling it, or you're missing it a little bit.
So I think that was really good advice. So especially when I first got hurt, like I couldn't feel when I had to go to the bathroom, which is like super normal for like people with spinal cord injuries and stuff like that. And that was like really good advice. Like if you're going out with some drinks and you see your buddies going, you go. Now, for the most part, I can feel it, but still, I'll be reminded if people are going more than me, I'm like, all right, maybe it's time to empty the bladder.
No doubt. Okay, next question. Is it painful or normal to see blood? The response is early on, a few drops of blood or mild discomfort is common. Just call your provider if it sticks around. You agree? I'm going to agree, with the caveat that cathing should not be painful. And if it is, we need to look at technique, another product, strategy. Like there are options. Cathing should not be painful with catheter insertion or removal. I would also agree that in the beginning, sometimes there is a little bit of blood because typically a Foley or an indwelling catheter has been removed. And so there's a little bit of trauma. Yep. And now there's not something in the body. So for lack of better terms, like the trauma to the urethra starts to heal. And then when you insert a catheter, it's basically going to kind of open up some of that a little bit more. Yeah. So that being said, there is a little bit of, blood oftentimes in the beginning. It can either be clots or sometimes the blood might be a little bit, it can cause the urine to come out a little bit discolored, kind of like a dark, like an apple juice type tinge. So monitor, follow up with your doctor, but keep in mind, cathing should not be painful. Be painful. Great. How do I avoid UTIs? Stick to clean, non-touch techniques. Hand wash genitals. Stay well hydrated. Your pee should mimic the color of light lemonade, not apple juice, right? Mm-hmm. All right. Pretty good. Yep.
Yeah, I agree. For me, so everybody's different. So Leah talked about her friend who's just like a maniac and can get away with anything. And some people are like that, and that's good for them. It's like some people, in life, they just like never get sick, like no matter what, which is just great for them. But for me, I would say the biggest thing that's worked for me is just drinking water. So if I drink like an insane amount of like soda or alcohol or whatever, and I'm not drinking water, that's where I run into problems for myself. So find what works for you.
Yeah, no, love it. Number 5, can I still have sex, swim, or hit the hot tub? That was the question. The response is yep, just cath before/after sex, skip hot tubs if skin's broken, and if your leg bag ballooned during swimming, you're not alone. What?
Yes, yes, and yes.
Wow. Okay.
Period.
Wow. Yeah. Period. It even put a little winky face on there. All right.
That AI get in
I know. It stuck it in there on the response.
Questions.
That's just how they respond to him. Okay. The last question on the frequently asked questions is, what if I can't insert it or remove it? Relax, take your time, wait 10 minutes, breathe slowly. If that fails, call your clinician. Common mistake, forcing it in.
Do not force the catheter.
Do not force it in. Right. No, you guys, today has been amazing. Thank you so much for joining me.
Thank you for having us. This was
fabulous. This is great.
Yeah, thank you.
You're welcome. I'm Jenny with Bladder Chatter, and I'm super excited about what's to come in the future of our segments. I'm chatting with caregivers, providers, OTs, PTs, basically anybody who will sit down and have a convo with me. I'm happy to entertain you and keep things going. All right. Thanks, guys.
Thank you.